Stigma is when people have like a preconceived notion about something and make it more like negative than it is.
So I would characterize stigma as someone or something getting labeled by other people's opinions and oftentimes misconceptions.
As a teacher, I've defined stigma as like a negative mark that's placed upon something. So it's usually not a good stereotype, essentially.
Stigma is like a sense of shame or some kind of negative connotation related to a attribute that somebody has.
According to a survey done in 2019 by Eastlake students, 89% of respondents said they knew someone with a mental illness, and 30% of respondents said they had a mental illness. 40% of the people who said they had a mental illness responded stating that they had faced some variation of stigma.
That people can just shake it off, that people with mental health disorders are doing it for attention, that if they are using medications for their mental illness, that they're lazy and that they're just using the quickest option to get help. So maybe more of it that they don't require a doctor's help, and that it's just easy to get out of.
So some common stigmas would be that people suffering from mental illness are that they bring it on themselves, like they deserve to have those issues, that they're dangerous, that they're not worth helping, or that they're defective in some way.
No, definitely not. There's lots of them, right? But even if you look at, say, anxiety, okay? So someone who has anxiety, anxiety shows up in different ways. So even the same disorder can show up differently depending on the person.
I would say no. And I think that's the interesting thing about working with mental health is that there's some categories that can bring about mental health conditions. Drug use is one. Trauma, so any sort of past trauma or event that's occurred. There's a lot of theories out there that mental health conditions can be genetic. They can also be caused by an imbalance in our neurotransmitters in our brain. So sometimes it's a combination of all those things together that lead to a mental health condition.
There are many different stigmas. There are many different mental illnesses as well. They all have different symptoms, treatments, and people living with them face their own stigmas.
I think some of the roots of stigmas placed upon mental health disorders is just lack of knowledge. I think with a lot of things, like without enough information, you don't necessarily know all sides to someone's story, and so just without the amount of information that someone has is where these stigmas come from, because they just don't know what this person's going through.
So for mental health and stigmas, that's been around for ages, like since early medieval times. There's always been stigmas related to mental illness and mental health. So it's hard to pinpoint why, but generally people feel uncomfortable when someone's different than them, and especially for specific mental illness. Some people might act in a erratic way, and so they're trying to explain that themselves. And it kind of some of that stems from thinking that maybe they're possessed, like some of the explanations are related to religious reasons or being possessed by the devil or things like that, and so that's kind of where it stems from.
Roots. I think discrimination against a certain group it causes stigma, and it's also kind of a reaction to stigma. I guess stigma is kind of like what society says is valuable and invaluable, and I think like any stigma against any group of people, it has a long history of being perpetuated by people in power, and the people in power say that they're the ones that are valuable and that everyone else isn't, and that message gets passed along generation after generation through society, and the invaluable group deemed by those people gets stigmatized.
Well, I think if there's a stigma around mental illness, people might be afraid or not want to seek help. So, because they might not want to be labeled a certain way or feel like they could be labeled a certain way if there's a diagnosis or they reach out for help.
I've definitely had students face stigma. One in particular, I think, that I mentioned earlier is my young men who come in seeking support often don't want to talk about themselves, don't want to talk about feelings. Usually it's a behavior that makes them come to my office. So rather than say, like, I'm unhappy and sad, typically it's I got into a fight or I tried vaping or something and got into trouble and then was forced to come to counseling, rather than acknowledging that I was feeling super down and that's why I'm so angry, or I was feeling super anxious, that's why I tried vaping, instead of acknowledging what's really going on.
Stigma around mental illness have been around for ages. It is believed that the stigma comes from the idea that the mentally ill were possessed by demons. This idea came from the religious elite, who believed that mental illness was a spiritual punishment more than an actual illness. Since then, there have been many medical advancements, and we know that mentally ill are not possessed. However, the stigmas still have not disappeared.
Great question. Why are mental illnesses demonized? I feel like they're demonized because they're not visible. So because they are in accordance to the brain, they're not, you can't just see, oh, they have anxiety, oh, they have depression. And that because there's so many ways that someone could have one or both or all, that they I don't know, that there's no proof. So essentially, like they're like ghosts, essentially, like ghosts.
I definitely think there's a few sides to it. One is, again, back to that idea of individualism, of taking accountability and responsibility for yourself. It's often viewed, mental health conditions are often viewed as something that that you can change, that are a part of you that is somehow weak, or and so society tends to devalue people who appear kind of like they can't manage themselves.
I think we don't act upon them. So even if a stigma says that a certain person might be dangerous or lazy if they have a mental health disorder, if we actively put that out of our minds and treat the person like everyone else, and as if the stigmas aren't true, because they're not, I think just almost that opposite action of what the stigma tells you to do, purposefully not doing it, is one way. I think it's also passing ideas down through generations, and also through passing your ideas through friend groups of not to judge people for a certain identity, and in fact to support them and celebrate that identity. And I think just talking about mental health is one way to kind of try to beat the stigma against mental health, because things that are stigmatized, people don't want to talk about it or identify with it for fear of people discriminating against them. And once you start the conversation, you clarify a lot of misconceptions, and many people will drop the discrimination that they're, well, hopefully will drop the discrimination that they're acting.
Educate people more on mental illness. I think just speaking about it, not being afraid to discuss mental health issues. I think in the recent years, it's become a lot better. It's in the media. It's something that is talked about. It needs to be more than just a health class or an LTI documentary.
Positive portrayals in the movies. There's also support groups, and there's a group called NAMI that is all about getting positive mental health out there and educating people, so more support through that organization.
What can you do to help reduce the stigma surrounding mental health? If you are a part of removing mental illness stigma in society, you're helping everyone affected by a condition. There are 2 easy ways to do this, which can be listed in an easy way to remember. Always use the acronym PS. Use person first language. This means that a person is not their illness. For example, say, she has depression, not she is depressed. Do not use offensive slang. A person with a mental health condition is not crazy, psycho, insane, or loony. When one uses these words, they imply that a person is solely their illness. Always remember, PS. As Michelle Obama once said, whether an illness affects your heart, your leg, or your brain, it is still an illness, and there should be no distinction.